I've actually come to the end of the case discussions here, and what appears to be very clear as far as nocturia is concerned is that it is a syndrome. It is a constellation of a lot of medical problems, and unfortunately or fortunately, we as urologists have to deal with them. And if you looked at the old textbooks of surgery where urology had only 10 pages in it, if they had an old man with urinary symptoms and they said nocturia, you do the prostatectomy and his nocturia will go. And they stopped at that because they never evaluated what happened to the nocturia. And there are many men who had their prostates removed and still have nocturia because the reason for nocturia was not the prostate. And we now learned over the years that I think you need to be very careful before you offer any surgical intervention, especially in the lower urinary tract. Because once that is done, that cannot be undone. You must remember that if you cut the prostate, if you cut the bladder neck, you can't go and seal it up again. It's gone for good. And whatever happens is going to be blamed on your decision, and the patient come back and tell you, you did an operation for me, I didn't get better. So please be very careful when you have significant nocturia in the evaluation of your patients with LUTs.
Especially in diabetic, especially if they come even with a significant post-void residue, we must not forget about the autonomic cystopathy, and we have to tell them that we may remove the mechanical aspect of the problem, but whether the patient will pass urine or not will depend on how the bladder is functioning. That has to be told as part of counseling. Whether it is prostatensia or prostate, we have to tell them.
So fair enough. So let's move on to something which is a new kid on the block, and this is melatonin. How many of you here have taken this drug before? I can bet without asking them individually that they've taken it not for lack of sleep, but for jet lag. Correct? So it's for jet lag. That's how it came about. Melatonin for jet lag. And then they said, oh, because the circadian rhythm is being changed when you go, especially from the east to the west. When you go from the east to the west, you have a problem, and therefore you take this jet lag drug called melatonin. And then they said that, when we were all anatomy students and all that, we said there's a gland. There are a lot of vestigial organs in the human body. And the pineal gland was told to us as a vestigial organ. And they said it's some small thing sitting in the hypothalamic area below the pituitary area and all that. It's of no use to all of us. That's what we were told. But today we know that the pineal gland, small it may be, has a tremendous role in controlling our sleep and circadian rhythm, and melatonin exactly, and related to the suprachiasmatic nucleus and the superior cervical ganglion. And this is where exactly the changes in light and day happen, and therefore we use melatonin. Melatonin by itself has got a lot of drugs, a lot of effects. It inhibits the micturition pathway directly at the cortical level, also at the peripheral level, at the voiding level, and also helps in increasing the bladder's capacity and thereby improves the quality of sleep because it directly affects the sleep cycle, the circadian rhythm. So this drug is now being used, and the European guidelines do indicate that this is a safe drug to use in our patients with nocturia, where all things are equal. But remember that the drug has to be used with caution. Every drug has got its own little side effects, but generally speaking, this is a safe drug. I think the gentlemen who have used it have not suffered yet, and they're all quite happily sitting here. They've had a good life using melatonin. It's a very simple drug to use. You just take 3 milligrams. Some people say between 1 to 5 milligrams. What's available here is 3 milligrams. The only thing is you do not use PDE5 inhibitors to treat nocturia. All the other drugs can be used in various combinations, antimuscarinics, this, that, in patients with LUTs, BPH. But this drug can be as an add-on to patients who've got nocturia. And 3 milligrams, you give it at night, and within 1 hour, the blood levels rise, and it's a good drug to take. And I can see Ganesh Kamath very happy with the drug. I think he could be a promoter and a brand ambassador for nocturia and melatonin. So thank you very much.